Well, good evening, everyone, and welcome to the panel on What Can I Do with a Nursing Major? My name is Kayla Karst, and I am a sophomore career assistant here at the St. Ben's Career Resource Center. Tonight's format will involve our panel members taking a few minutes to introduce themselves, and then we'll open it up to questions for all of you. We will have the session go until approximately 8 p.m., and then we will provide an opportunity for you to stay and talk to the grads individually if you'd like. Please take time to complete your evaluations at the end of the panel. Now, I'd like to turn it over to the panel and their introductions. Thank you.
Hi, everyone. My name is Alison. I graduated in 2010 from St. Ben's, and I remember going to this thing senior year, so this is cool. I had my capstone experience at the U of M Amplatz Children's Hospital on the pediatric bone marrow transplant unit, and that's where I ended up getting hired. So I've been there ever since for about 2.5 years now. I love it. I'm precepting students and also new employees, and I'm currently in the process of applying for grad school. So that's where I'm at now. It's good to be here. Thanks for coming.
Hello, how's everybody doing? Okay, good. Very excited, I can see. My name is Patrick Murray. I went to school here, obviously. Graduated in 2001. I did ROTC through college, so when you see the people, I don't know if they still do it on Wednesday when they wear the camouflage outfits, and people make jokes like, Patrick, where's the rest of your body? All we can see is your head. That got really fun. Anyway, so finished college and went into the Army. Did that for 4.5 years, and when you go into the Army as a nurse, you start on a med-surg floor, so I did med-surg nursing for about 2 years. Got to do pediatrics to geriatrics, which was a very good experience. Got to kind of cut my teeth doing all the IVs and catheters and all those kinds of fun things that you're learning right now, or hopefully going to learn shortly. While I was doing that, I was kind of seeing other types of nursing at the hospital I was working at, and so had people that were ER, OR, ICU, and kind of took a liking to the OR. Quality of life kind of looked decent. They don't usually schedule surgery at night. They don't work straight nights, straight weekends. So I was like, well, you know what? That sounds like a fun time. And I was young. So in the military, you go for extra training. So I did 16 weeks of OR training and did that out at Walter Reed. Came back, and then I was an OR nurse. So I did that for a while. And then I got activated to go to Iraq. So I went to Iraq for a year and did trauma nursing, which was a little different. But got to see a lot of unique things and help soldiers and also civilians over there during very traumatic times. Came back stateside, did some more OR nursing, and my term was up, and I said, what do I want to do with, where do I want to go next? And a bunch of my friends from school here moved back to the city, so I went back to the cities and took a job at an orthopedic center, because that's kind of what my primary focus was in the OR. So I did that for a little while, and with the military training, I was kind of at the crossroads. Do I want to be in management? Do I want to go back and get a CRNA degree and be a nurse anesthetist? And so I tried for a manager position, and I didn't get it. But with nursing, you'll find out that there's always another avenue. So I said, well, I'll keep doing OR nursing. And people are like, well, didn't you talk about going to CRNA school? So am I taking up too much time? Are you guys okay with this?
You're
okay.
good. You want to explain CRNA?
Sure. Certified Registered Nurse Anesthetist, which is a master's degree, which if you've had surgery or procedure, those are the people who give you medication, sedation, and analgesics to basically, if you know you have pain, you don't care you have pain. So those are the people that are usually at the head of your bed during surgery. Now you got me sidetracked. Jeez. I'm all nervous up here, and I'm rambling.
No,
Today?
we work together.
Today? What?
We're going to work together.
Yes, we're going to work together. We actually used to work for the same organization. Small world. I'm rambling. So I'll stop rambling. So got passed over on that leadership position. CRNA school. Well, to be a nurse anesthetist, you have to have critical care. So you need about a year of it before you're supposed to apply. That's kind of the unwritten rule. So I went to ICU. I said, you know what? I'll just go to an ICU. And like I said, with nursing, there's so many avenues. I was doing ICU for about 10 months, and the person I used to report to said, you wanted a management position. We're going to open up another management position at the same facility you used to work at. Do you want to come back? And at that time, where I was in the ICU, it was straight nights every other weekend, because when you're new, you kind of have to put in some tough hours, which happens on every floor you'll work on. And I said, well, that sounds like a great idea. And I was courting my wife at the time, and I wasn't ever seeing her. She worked days, I worked nights. So I went back, took a leadership position. I was doing that for about 5 months, and I got promoted within the next 7 months to the position that I got passed over on and ended up as the manager at that facility. So kind of was doing that split, leadership, nurse anesthetist. I gave up on the nurse anesthetist. I said, you know what? I'm going leadership all the way. So I actually went back to school and got my MBA and just left the position that I was working at the same company at Park Nicollet, and just started today as a director in an operating room, and kind of am progressing in that leadership model. So that's my story.
All right, my name is Maureen McConnell, and before we go any further, I'd actually like to know where you guys are at in your education. So can I do that? Yeah. Like a show of hands. First year students? Oh my gosh, okay. Second? Third? Thank you. Fourth? Okay. Nice. How about fifth? Okay. All right, I took that track. So, I'm Maureen. I grew up in the St. Cloud area, and St. Ben's has been home for me my entire life. My dad used to work with Mary here in the Career Services Department way back when, and so I was very fortunate to have him as a kind of my own personal career guidance counselor. So he helped me quite a bit in my journey. I sought out the nursing profession because I couldn't be a fighter pilot. And I'm happy to say that as of, 2013, women can now fly combat. Way to go. So nursing was kind of a just as exciting opportunity for me. I started out at St. Cloud Hospital, working through high school and college in the emergency room and housekeeping. It was a great way to get into seeing what really happens at the bedside. But when I graduated from St. Ben's, I did not have a fantastic first couple months after school. I was very involved in my class here at St. Ben's, and was engaged to be married and was just going to start life off rip-roar, and I had planned everything out. And my life kind of came to a halt when I didn't pass my boards. And that was a very traumatic time for me because that's not what you do. You pass your boards. So I ended up moving to Tennessee. My husband was stationed there after I got married. And he was ROTC as well, so we were stationed at Fort Campbell, Kentucky, and I worked in Nashville. And I had never left Minnesota before, so it was a new experience being out of the house, newly married, not passing your boards, a new grad, and trying to find a job when there were no nursing jobs at that point in time. Luckily, everything turned around, and I passed my boards with flying colors the second time. But I began a career of kind of jumping around and moving from state to state. So I worked in Nashville in pulmonary med-surg. Never thought I would be working with patients on ventilators or anything, because my goal was to work labor and delivery. So we got out of the military, moved back to Minneapolis, and I worked at North Memorial down in Robbinsdale and worked labor and delivery. Fantastic experience, nights and weekends, as Patrick said. And then my husband decided he wanted to join the FBI. So we moved to Phoenix for a little while and worked there, and then we moved to San Francisco. In both of those areas, I worked labor and delivery in both a very small department as well as a really large department. Moved back to Arizona, and then about a couple years later, moved back to Minnesota. So I vowed I'd never step foot back in Minnesota, but here I am for the third time. So when I moved back, I did not want to work nights and weekends. I wanted an 8-to-5 job, so I went, instead of hospital nursing, I decided to go clinic nursing, and I really thought that was going to be a really easy-peasy kind of job, because how hard can a clinic nurse job be? But it's the most rewarding and the most challenging position I've had. They took one look at my resume and said, you went to St. Ben's, you've got a unique background, you need to look at leadership. And I was kind of surprised at that, but the St. Ben's name does some good things for you. So I started off as a supervisor at a clinic, and then I quickly became a regional manager and then a nurse manager for about 10 locations, and now I have the role of a senior clinic manager for OBGYN within Park Nicollet, and excited to share my experiences with all of you, so thank you.
My name is Michelle Stenbeck, and I'm the oldest of the group. In terms of, I graduated in 1991, and I'll just tell you that when I graduated, the nursing boards were in big, long halls, and they were like, I think 2 8-hour days, and you had to keep your head down, and if you needed anything, you had to put your hands up, and you had to wait 6 weeks for your results, not 2 or 3 days or however long you have to wait. So if I took the time to tell you every step I've made, we'd be here until 8 o'clock, so I won't do that to you. I have been staff in med-surg unit. Started at Abbott Northwestern Hospital. I was an assistant head nurse, moved around a couple units there. I went out to a smaller regional medical center, and I was a care manager and then a manager. And after a period of time being a manager, I wanted to get into my master's degree. And I was managing about 110 staff between Med-Surg, ICU, Cancer Center, and the Social Service Department. So I stepped back from that and went into operations and actually spent a couple years as their IS site manager, so nursing and IT. That's something that's becoming a bigger area of focus for nursing. And then in the last couple of years, after I graduated with my master's in leadership and management, I wanted to get back into clinical work, so I am now at Abbott Northwestern Hospital again, where I started 23 years ago. And I was managing an interventional radiology department, a very cool department where they do really wicked things. And after about a year, which I'd never left a position in a year, so that was odd, the CNO called me and asked me to manage our advanced heart failure floors. So we do some really cool things on that floor with patients in heart failure that are either bridged to transplant or we call destination therapy. So that's where I am currently. And I just found out today that Patrick started, so we'll be seeing each other around the halls of Abbott, so that's cool.
Hi everyone, my stories are pretty short. I graduated this past May, and I was a student at St. Ben's for 4 years. During the 4 years, I did some clinical research with Carrie Brown on the pediatrics unit at St. Cloud Hospital, and then I got an internship position at Huntington County Medical Center in their pediatric intensive care, and spent 10 weeks there and really loved it. And I thought pediatrics is where I want to go, the only floor that I want to work on in my entire life. And then by the time I need to apply for jobs, and I started to look around and kind of extended my view and thinking maybe I should apply into more positions. So I applied to the new grad residency program at Maple Grove Hospital. It's a year-long program where you have 12 weeks long orientation with year-long classrooms, times where you can talk to your peers and discuss what you learned. So that's what I'm doing right now. And after that, we can do a critical care residency program. So that's what I'm looking into right now.
Hi, everybody. Well, I am not the oldest grad from St. Ben's, but I'm probably the oldest one in the panel. I have done a lot of different things. I am a 1983 graduate of the St. Cloud Hospital School of Nursing. That was a diploma program. They don't exist anymore. That program closed in 1986. It was felt that nurses needed either a 2-year degree or a 4-year degree, not a 3-year diploma. I really liked the 3-year diploma program because an inherent part of that was 6 weeks of clinical in every specialty area. So whereas in current programs you get a few days or maybe a week or two of clinical experience in the various specialty areas, I had 6 weeks. 6 weeks in ortho, 6 weeks in oncology, 6 weeks in OR, 6 weeks everywhere. And so basically when you're done working, you're really ready to work. I graduated in 1983. There were 67 students in my class, I think 3 guys and the rest women, and 3 of us got a job. There were no jobs. You could get a job if you wanted to go to Arizona or Tennessee, but most people, if they wanted to stay here, kept their nursing assistant or their housekeeping positions. I was one of the lucky ones. I had done my leadership 3-month training in the OR, and they had a position for me in the OR. That isn't where I wanted to work, but I took the job. I had a 2.5-year-old son, a 1-year-old daughter, and a baby due in October. So when I graduated from that program in June, I took the OR position and I worked in the OR for a couple years. I wasn't crazy about the OR. It's a great place to be, but I like my patients awake and talking to me. My passion is psychiatry. I went back to work in the mental health area. I had worked in mental health as a nursing assistant at the St. Cloud VA Medical Center. And when I went to nursing school, my goal was to be a psych nurse. That's what I wanted to be. But there were no jobs, so you take the job you can get, and that was in the OR. It was a good experience, and I've worked in the OR since a couple of years here and there, which is fine. Working in the OR in a small hospital, by the way, is great because you work OR, ER, you do admissions, usually some endoscopy, some recovery rooms, so it's a lot more variety, a lot more interesting. I went back to work in behavioral health, and with my 3 little tiny children, gradually took classes at St. Cloud State, 1 or 2 at a time, and then came to St. Ben's in 1990. They had a program, I don't know if they do anymore, but it was an advanced standing RN program. So if you had a 2-year or a 3-year degree in nursing, you could go to this 2-year expanded program and get a bachelor's degree. So I graduated from St. Ben's in 1992. Then my family moved up to the Duluth area, and I wanted to go to grad school. So I started grad school in 2001 and graduated from the College of St. Scholastica. I'm a nurse practitioner. I work in psychiatry. I have worked for the state of Minnesota in the Minnesota Sex Offender Treatment Program, both at the Moose Lake and the St. Peter Regional Treatment Center locations. I also have worked in the Competency Restoration Program at Anoka Regional Treatment Center. That's the program where if you're charged with a crime but deemed incompetent to stand trial, you're then indeterminately civilly committed to the Competency Restoration Program until you're deemed fit to stand trial or the charges are dropped. I did that until my job was eliminated in 2007, 2008, and my husband was about to retire, and that was the reason we had moved up to the Duluth area. So I came back to work in St. Cloud. Have been working at the VA Medical Center here in St. Cloud for just under a year. Prior to that, worked 3 years at Centricare St. Cloud Hospital. Had a clinic practice at Centricare Plaza by Hennen's Furniture in adult psychiatry, and I also did psychiatry consult service at St. Cloud Hospital, where you go all over the hospital and see patients in all different units who have a need for psychiatric consultation. I really like what I'm doing now. Monday through Friday, 8 to 4:30. No weekends, no holidays. The VA starts you off as a nurse with 5 weeks of vacation. Lots of federal holidays. Great working environment, and working with veterans is absolutely the best place that I could ever be. I really like working with veterans. So, and I'm done going to school, but I love teaching. I did teach at St. Scholastica for about 6 years when I was up there, and I love doing that too. So, nursing is a wonderful career. You can do anything, go anywhere, work any shift, work part-time, full-time. It just has endless opportunities, and there's a huge demand. So, congrats to all of you guys for your interest, and I wish you success.
We got 40 more minutes, so you better think of some good ones.
Ask questions. Can I just say one thing? When I went to my original program and when I went to St. Ben's also, there used to be a rule, and it was never in writing, but it was just a known rule. It was one of those common law things. You were not to think about going to grad school until you'd had 5 years of nursing experience. Yeah. It isn't like that anymore. And when I taught at St. Scholastica, there were a number of students. I taught in undergrad nursing. I taught psychiatric nursing. I taught leadership. I taught clinicals. There were a lot of students when I went to grad school there that had gone right from their baccalaureate program right into the grad program. I would not advise you to do that. I think it was way harder for those students to grasp the information and to use it practically speaking than the students that had had some years of experience. It doesn't have to be 5. Right. But I would say if you want to go to grad school, that's great, but at least get a couple years of experience. It will make it much easier for you in the long run.
I would agree. I did my master's in nursing with focus in management and leadership online at Regis University, and I could absolutely tell those who had had enough real-life experience. I had enough experience in the workplace at that point that some of it was kind of a bit second nature. So I would agree some life experience is good. And I'll also tell you, for the couple of you here that are seniors, I hire new grads. Well, and you know, the fact of the matter is, Abbott Northwestern Hospital is a magnet designated facility, and so our real reach is for baccalaureate prepared nurses. And I was just reading an article yesterday from the Institute of Medicine that they're really proposing that by the year 2020, 80% of nursing students really need to have their baccalaureate, and they're really pushing for that. But in a magnet designated hospital, as a manager, you have to have your bachelor's. They give you a certain amount of time to get it, or you're fired. If you are a director, you have to have your master's. They give you a certain amount of time to get it, or you're fired. That's just the way it is, because when you're in a 600-bed facility, you need to be progressive. You need to keep on that track of learning. So, see me when you're done.
How did you guys know you wanted to be a nurse, and have you ever regretted it? Like, have you ever looked back and been like, oh, I wish I had done this?
Absolutely not. I don't know what I'd be if I wasn't a nurse. It's like, so I think since I was 9 or 10, I have no idea what I would be if I wasn't a nurse.
There's so many different kinds of nursing. For a couple of years, I did IT, working at St. Mary's Duluth Clinic in Duluth. When they were bringing on board the EPIC electronic medical record, went to extensive training, and I'm EPIC certified in ambulatory care. And I mean, really, when in nursing, if you don't like nursing, like bedside nursing, you can do administration, you can do any kind of leadership. I mean, you can do education, you can just do anything. I mean, there's just so much that you can do.
I'll agree with that. Do you want to agree? No? Still
actually,
new?
I have kind of a different story. I always wanted to be a grade school teacher. And then, like, in high school, I took anatomy and physiology and was fascinated by it. I wasn't really a big science person, but the thing about nursing is it combines those things. So it's like an art of caring, working with people, working with children. I always knew I wanted to do that. But then the science part, it's a whole other realm. It's a perfect balance. So you use those things in your art of working and caring with people. So it's kind of a beautiful thing. So ever since that class, I was like, heck yes, I can do this. So that's my story.
I'd say for me, besides agreeing, was just being younger and I'd had some procedures done, minor. Really liked the aspect of care. Had a really good friend, his dad was a nurse anesthetist when I spoke of nurse anesthesia. And when I talked to him, he really enjoyed his work, had a lot of flexibility, enjoyed everything he did with nursing. My sister actually graduated from St. Ben's as well with a nursing degree, so I got to see her go through school, and she really enjoyed it and had a lot of versatility. And just like the panel talks about, you pretty much can find every career in nursing. If you want to be a teacher, you have instructors that were nurses or are nurses. You want to be in management, you have nurses that are managers. You want to be in schools, be a school nurse. I mean, you can touch every aspect pretty much of any business being a nurse. And so that's one thing that I've really appreciated through I only have about a 12-year career, very short career, but I've done so many different things that I don't know what I really want to be when I grow up. But there's so many opportunities that once you have the bachelor's degree, you can go back and be a nurse practitioner. You can go back and do any type of advanced degree for the most part and continue on doing whatever you find you want to do. So that's the one fun thing about education and nursing is that you can keep building on it and have so many angles to take.
I would agree with that too. Just to add to Patrick's, you know, one of the things I wanted to do is that fighter pilot. I wanted that high drama. So I looked at the ER, I looked at labor and delivery, that ICU kind of fast-paced, more one-on-one type patient care. But I also appreciated my med-surg background, which was managing multiple people with families and with different expectations. So I think with nursing there is everything from, you know, Mach 10 with your hair on fire kind of thing to hospice nursing where you're dealing with end of life. And so there's so many options, like everybody said, that you can pick your pace, your speed, your level of technology, and your level of hands-on personal care. So, yeah.
You guys mentioned that you were in management. Did you ever have to go back to school to get like anything like a business or management kind of like minor or anything? Did you go back to school for that?
So mine was, I had military experience, which in ROTC you're trained to be a leader, and then when you go out you're essentially expected to be a leader. But yes, to get to the position I'm in right now, I had to have a master's degree. So I did go back and get my MBA, and I just finished that up 6 months ago.
When I started managing, I did not. I left my care management position on a Friday, and I went 2 doors down to the manager position on Monday. And the manager before me, I remember thinking I want to be in leadership, and I remember as she was cleaning out her office, this arc to the garbage, and she was like laughing. And I had so much to go through in terms of like reports and separating the unit. It was a lot of self-teaching, a lot of inquiry, I had some really awesome leaders at the hospital I was at that taught me. And over time, Alina Health has developed classes to help leaders, but I had gotten a lot of what I needed before I started my master's program, but you have to be you have to ask a lot of questions and you have to be on your toes because at St. Francis in Shakopee, where I used to work, med-surg, I remember my president used to say, Michelle, if med-surg performs, St. Francis performs. If med-surg doesn't perform, we're all in trouble. So it was pretty intense in terms of trying to make it happen, but they also supported me a lot. I don't know. I don't know what you guys get for business. Do you get any business aspects of your education? Not so much. Very little. I mean, the good news is I think we're all on board with knowing that healthcare is a business, and as we look at where the healthcare is going today, we have to really understand that, and organizations are positioning themselves to make sure that leadership is supported differently than when I started. So I think we're in a different place in terms of how we can help onboard people for that. Yeah.
Would you recommend getting your CNA as a coming college or as an oncology class?
Yeah, I mean, how many of you guys did that? Yeah, CNA, yeah, no? I think it's a foot in the door, and I'll tell you what, I'm a hiring manager at Abbott's a 600-bed hospital, and right now, last spring, we had over 2,000 applications for just over 200 positions in all of our 11 hospitals. So if you have your foot in the door, our goal is to promote from within. If you're working in a place and you're doing a great job, we want you to do well, and that's a really good, I mean, it's just where you see people and where you know, are they going to make it as the next, best employee? Because right now, we have the ability to skim off the top, and that's what I do.
Not only that, but you get some really great experience.
Absolutely.
I agree with them. I never had a CNA job because I have been an international student while I'm here, and I can't work off campus, so all I did was a campus job. And I find it really hard to find a good job by the time I'm applying. I have a decent GPA. I worked really hard in college, and with my research experience and internship, I was finally able to land a job. But I feel like the road was long and it took me a really long time. So I would definitely recommend having a CNA job, especially in a hospital where you're really interested in working after you graduate.
I'd even recommend, if it's not a certified nursing assistant position, an orderly type, or like an ER tech or a phlebotomist working in the lab. I started out in housekeeping, totally unrelated, but you're at the bedside, you're watching how nursing is interacting with the patients, you're watching the patient. They're going to talk to the housekeeper before they're going to talk to the nurse.
Yes.
Sometimes, so you kind of got in on less there. But I think any way that you can find a track in is really important, and just to be, even just volunteering in an environment that you might be interested in is a fabulous way to start.
One of my new grads that I hired just a few months ago used to work in the dietary department. So.
Yep.
And I'd say even not just for job experience, I mean, not to get a job, but just to find out if you're going to like it. Because depending on where you work, the size of the facility, and some people talk small facility, when you're in OR, you're admitting your district, you're doing everything. Leadership positions, one of the questions was, some facilities, you don't need an advanced degree. Just depends on where you're working. But the nice thing, I worked actually at the St. John's Health Center. That was kind of my experience. But one thing that was a disadvantage in clinicals, I had some of that stress about how do I roll the patient properly and do all this stuff, and I got to do this. And some of the people that were in the class that were CNAs had done all that stuff, so they didn't have to worry about that. They got to hone their technique, whereas I was still learning the technique. But you'd also, I mean, clinical, I felt, we don't have 6 weeks necessarily in every part of nursing. It's a great opportunity to find out, am I going to like nursing? And if so, what type of nursing do I want to start out in? And you hear from us, you can change every 6 months if you want. I mean, if you start bouncing everywhere,
Don't do that.
the hiring leaders are going to look at you and go, why are they bouncing every 6 months? But you really could if you wanted. But it really helps you find, it gets you in the door, and then if you're working on a med-surg floor, you get to know some of the nurses. Say, you know what, do you know anybody in the OR? I'd like to go down there for a day and just shadow. Whereas a person off the street, it's going to be a little more challenging for you. But that's a great opportunity just to say, do I like nursing? Hone those skills that, you know what, if you're going to follow nursing, you're going to have to do them and you're going to get graded on them. And it's nice to not have to think about that and have other things in your mind about what system am I worried about now, not, oh, how do I get dressings together and how do I move this table? You know how to do all that stuff. So it's good hands-on experience.
If you work with children, what do you think is the most difficult part of working with children?
The bone marrow transplant unit is a pretty critical unit, so you get very emotionally attached to the children, and when things don't go the way they should, it's seems very unfair. But it's also the most rewarding thing to work because they make everything so much more fun. One of the challenges is also working with the families. Their parents are your patients also. These kids have siblings that are your patients as well. So I guess that's one of the most challenging things too. So it depends on like what kind of pediatric unit you're working, but people are like, oh, it's so fun to work with kids, and it really is. I couldn't imagine doing anything else, but it presents with its own challenges as well. In this nursing program, I was taught a lot about family-centered care, and I can tell that I have that in the back of my mind because you walk into the room, the family is your patient. So I think that's one of the things about this program that is instilled in me, and so I try and work by that ethic and theory and concept, which I think has really paid off. So, but it is challenging as well because you don't have just one patient. You have, which goes, with adults as well. But parents are very active in their children's care as they should be. But so that's something that I'd say. Mm-hmm.
So there's several variations you can do. I did a 4-year scholarship, so all 4 years I did actually classes over at St. John's side in the military science building, which is, I think, Rat Hall. So we had classes all the way through, but we had people who decided their sophomore, junior, senior year, you know what, I want to join ROTC, and they joined. And then there's people who graduate college and go, you know what, I'd like to join the Army. Their training's a little different. It'd be similar to your CNA question, where when I went through college and got to do all that training, when I actually started the military, all the stuff that the extra duties you have was second nature, whereas the people who finished college and then went into the military, they had a little more catch-up to do. I mean, they still turned out to be excellent nurses. But yeah, so at any point in your career, if any one of us, well, there's age cutoffs, but if any one of us pretty much before...
What are you trying to tell me?
You're in. Basically, cutoff is usually 35 with 0 experience, and I don't know what it is today. But that's what it was back then. But.
I still get mail saying, hey, whether you're a nurse,
There we go.
join the Navy,
So, I mean, there's, at any point in your career,
I'm over
there's an
35.
opportunity. And that's, along with just being a nurse, you're versatile, like I mentioned. But the military is a great place to get experience as well. Not that I want to oversell to anybody, but going in as an officer is a very unique opportunity. And when you're young, it's a lot of fun, too. But,
And
so, yes,
travel opportunities.
I went places I'd never go. I mean, I'd never probably traveled to Iraq on choice. But I mean, California, Texas, Washington, D.C., pretty much almost everywhere in the States, Seattle. But you can do that with nursing. You can be a traveling nurse and get all those opportunities as well. But the nice thing with the military is, you're employed and they pay the dime the whole way. So.
For the recent grads, did you feel like you were really prepared to go into the workplace as well as to take your boards when you left school?
When I left school, thank you. I feel like I'm really prepared for the boards, especially after the Kaplan and the test prep questions you do, you'll do well. If you don't pass the first time, everybody passed the second time, basically, from our college. Work-wise, I don't think I was completely prepared, which is normal. I think it takes new grads about a year before they really feel they're confident and competent when they walk into a patient's room. But I feel like that's why it's nice to go into a new grad residency program. For our program, we have 12 weeks of orientation, and usually a medical surgical patient load is 4 patients. That's the unit I'm on right now. We started with one patient for me and my preceptor. So for the entire day, we'll be 2 nurses taking care for 1 patient until we delve everything through, figure out the charting, figure out how to take care of patients, figure out how to talk to the families, and then we move on to 2. 1 to 2, the jump is a little bit bigger, and then 3 to 4 is a little bit bigger too. So it took me a good 3 months. By the end, I'm just like, I'm ready. I don't need a preceptor anymore. But I feel like you almost need that time to practice your skills and be comfortable doing what you do. And the nice thing about being in a residency program is you have people from different specialties you can talk into. Our hospital does postpartum, medical, surgical, and emergency nursing. So it's fun to talk to people from different units and float down to different units and see what's going on in the hospital. Even though you're hired into a position, you're basically still kind of a student and have the opportunity to go around and learn.
I think St. Ben's prepares you, like she said, with the Kaplan program very well for your boards. You're not going to feel like you're ever ready to take your boards, but you are. So I feel like I was lucky, and take the Kaplan, they offer it, everyone does it, and it's well worth the hundreds of dollars, but it is. As far as work, I feel like I was prepared. I was lucky because I had my capstone experience for spring semester on my unit. So that's where I learned most of my skills. But it's very unit dependent upon which skills you learn. And St. Ben's, I know, stresses the part about theory, and they even tell you we're not going to work on starting IVs and those kind of skills that you learn when you're hired. But ask questions. I still feel like I'm on orientation sometimes at work. I never am afraid to ask questions, or even helping me like with catheterizations, things like that. So I think that's the only part of work that St. Ben's prepares you for asking the questions, learning how to learn those kind of things, but not necessarily exact skills. But it's very unit dependent. I've never needed to start an IV on my unit, so that's why I don't learn it in school. But other units, other places, they do it multiple times a day. So St. Ben's prepares you very well for learning how to learn, I would say.
I guess it's not really a specific question, but what do you guys have to say about internships? Like, can you tell when like new students get hired, like the ones that have had internships, is that like extremely beneficial, or does it kind of not really matter? I don't know what to ask, but just something about that.
Unfortunately, I think with the budgets in the last couple of years, Abbott Northwestern, where I did my internship, many places across the line, they don't do them anymore. And the Board of Nursing has really narrowed down what the interns can do, so the value has changed in terms of how you do it. I think previously when we used to do them all the time, out of the gates you could tell who'd done an internship, but after a very short period of time, everybody kind of swims in the same, in the same pool. So I think internships, yeah, do what you can do, but for lots of reasons, people aren't doing them anymore, and I think it's really hard to do that. Because I remember I did my internship at Abbott, and then I pretty much walked on the floor, after I graduated, and I felt so much more comfortable just, being in the environment and the atmosphere and whatever. So I don't know. Do you do internships in the clinic?
Not necessarily. We're not doing a lot of internships in the clinic setting, but again, I think I would just tap back into, if you're seeking, if you want ER, then go for an ER tech job, and that way you can do it for 3-4 years versus an internship that's just concentrated for 6 to 12 weeks. So I think you can find other opportunities where you don't have that internship experience. But I would agree that with budgets and such, a lot of those programs unfortunately are being cut or scaled back. I love the idea of the grad nurse program. That's a fantastic way to get that extra time and education. But yeah, I'm not seeing a lot. Are you guys doing internships?
We have like the new grad residency program at our hospital, but I did my public health clinicals in South Africa and decided not to do an internship. That, I think it was junior summer, yeah. So I decided to do that instead of an internship, and I felt like the only reason the big help was my capstone project, but it was hard to convince them that since I had not done an internship, that I should still be hired. So that was kind of my class's way. A lot of my friends did internships, and it helped them get to where they were, but it was a little bit more challenging for me since I didn't. So I think it goes both ways, and it's very dependent on each year. It kind of goes in waves, probably. So.
And a lot of it's leader dependent and what type of organization you're trying to get into. I mean, if you're in the rural area, they might be just looking for anybody. Not to say that you guys are anybody, but it's really dependent on all those things. I mean, as a hiring leader in an OR, I'm just looking for experience. And for me, target is obviously OR. I want somebody that's going to come in with some OR experience. But second best for me always has been med-surg. Because somebody asked a question about management. When you're a med-surg nurse, you are a manager. You are managing not just one person's systems, but it's pretty rare that you walk onto a med-surg floor and you get one patient. Military's a little different. When I walked in, we'd do 8 to 12. And that was just trial by fire. You just did it. Same with all the skills. You did all the IVs, you did all the catheters, all those fun things. And the things that at that time I had the most anxiety about are the things I missed the most. I think about, gosh, I used to be able to throw an IV in anybody, do a catheter on anybody. Oh, 6 patients? No big deal. I mean, I miss that kind of stuff.
Right.
But I guess the biggest thing or the advice I'd give, or what's going to help you get a job, is getting experience. If I see that you graduated and then you've been an auto mechanic at Valvoline for 3 years, I'm going to go, well, did she really apply herself and try to get a job? I mean, did she try to go get if there's nothing, did she try to get a CNA, ER tech? Did she go and work in a nursing home at least? And I know those jobs are not liked by a lot of people. I know nights and weekends aren't liked by a lot of people. But the reality is, to get where many of us have been or are, you kind of have to put in some of the grunt work, but the grunt work is what gives you the base for all the things that we've been able to accomplish. It's that multitasking. It's those hard little tasks that you don't get anxious about those anymore. I mean, I remember in clinical, I'd have some anxiety about some of those things. You just get over it pretty quick. It's just that, it's that experience and getting in there and getting in the trenches and doing it.
You might not have to do an internship, but it's so much fun. Like, when do you get the chances to spend 10 weeks on the floor, not have to worry about things, and have a preceptor on your back and supports you through everything and let you explore? That's like one of my best experiences in nursing. So, and it makes a difference. Let's say if 100 people applied for internships and only 10 gets it. Maybe that means something. I would say if there's a chance for you to do it, even though a lot of people decide not to do it or can't do it financially anymore with the leftover spots, you should still fight for it because it's really rewarding. I absolutely loved my internship experience, and I think it's a little bit different from capstone, because basically during capstone you're placed at a site. The preceptor has to take you whether or not she wants a student or not, from what I heard. But in the internship, the hospital hire interns with the intent to maybe hire them later on in the future and make them really like the organization. So really, they really do go above and beyond. And at the internship at HCMC, they did reach out to me after I graduated. However, I took my job already at Maple Grove by that point. So go for it if you want to.
I was just going to mention, I had the good fortune of managing an interventional radiology department, which is not a common department that people would work in. So I encourage that no matter what your organization is, understand all the cool things that happen. In an interventional department, you have to have at least 2 years of critical care experience. But we're the department one of the departments that has the adrenaline rush that you talk about. We could be putting in a feeding tube for somebody and a stroke comes through the door and the table gets cleared and everybody gets their focus and their game on. And this last year there was a woman in her 40s who was just having signs and symptoms of a stroke that came from an outlying hospital, and they no more than got her up to the patient care floor, and she started garbling her speech and unraveling, and they zipped her down to the interventional lab, and we, can you give us your name, can you tell us your date of birth? And it was just a lot of garble. And the physicians went in through angio, and they were able to feed up to her head, and they saw the clot, and they plucked it, and just like that she goes. And it doesn't happen every time, but she goes, I know my birthday. So it's one of those departments where, people unravel pretty fast, but when you get your game on, it can be really good. So I would say, we do really cool things with liver tumors. Liver cancer is not very treatable. But there's new therapies out for liver cancer too, so now we can treat it right at the cancer instead of systemically, so there's better quality of life and longer life. And that's all done in an interventional department. Ask a lot of questions about where are all the nooks and crannies and the places that you're looking, because an interventional radiology department is not where a nurse necessarily thinks about starting or wanting to be.
So I guess my question is, have any of you guys done nursing abroad? I mean, I know that you were in Iraq, but have any of you guys done other nursing?
No, don't you know the prescription? You graduate, you marry a Johnny, and you move on. I got married right away, and stayed. No, I wish I would have, but yeah.
I did just a short 2-week trip to Haiti with my church, which was an amazing experience. But when I was at St. Ben's, we didn't have all the programs for nursing majors. You had to get in and get out in 4 years, and we didn't have that opportunity. I would give my left arm to go and try nursing in another country again. So if you've got that opportunity, take it.
Yeah.
That's a once-in-a-lifetime opportunity.
Yeah, that wasn't available when I was a student either. It just wasn't it wasn't, no one did that then.
Right.
I think it was maybe cost prohibitive, but I think it was kind of thinking way outside the box back then. It just wasn't on anybody's radar. But I've always worked in Minnesota. I've always, lived here and was born here. But I've done a ton of different things. Worked for an insurance company. I've been a school nurse. I worked in a sex offender program. Worked in the OR, in a correctional setting. I worked in leadership positions. I worked in clinical informatics. So there's just a ton of things you can do. Travel nursing, you could go anywhere. The Peace Corps, there's just unlimited opportunities. When I was teaching at St. Scholastica, they sent a group of nursing students every year to Tanzania for a wonderful experience. So if you have a chance to do that, do that. And I just want to put in a plug too. I worked 10 years for, night shift at St. Cloud Hospital, and there are some real pluses to work in those off shifts. You kind of can run the show without everybody and their brother coming in wanting to see the patient, wanting to see the record. Of course, now the record's electronic, so you're not fighting over the paper chart like in the old days. But there are some real pluses to work in those off shifts and those weekends. I worked 10 years of night shift, so my kids didn't have to go to daycare because I was sleeping when they were in school, and they could come home in the bus, and I was ready to get up by then, and that way they didn't have to go to daycare. Not every job, allows you that kind of flexibility. So there are some real pluses to doing that kind of stuff too. My daughter has a 1-year-old, my one and only little grandchild, and she works .5 on the orthopedic floor at Fairview Southdale in Edina, and it works out great. She only needs daycare like 1 or 2 days a week for an hour and a half until her husband is done at Honeywell, and my sister-in-law takes Logan for that hour and a half, and they love him to death. And she couldn't do that if she was in an administrative role or a leadership role. So there's something to be said for those off shifts and weekends that aren't really necessarily everybody's cup of tea, but boy, it's nice when it fits.
Oh, but you get really good at creative problem solving because there aren't
Yes.
as many resources on
Yes,
either.
you do. You work with your team and you make it work.
Yeah,
You make it
you do.
happen. And even a really nasty job is a doable job if you have a good team to work with.
So with a team setting thing, how important, like would you say nowadays, working in a team skill is becoming, like being good at it?
You have to.
Yeah.
It's a core requisite skill. If you are not a team player, you will be opted out by your teammates pretty
Yes.
quickly.
Yes.
You can't do it anymore, I don't think, without it.
I think Alison had a really good point, is that you commented about how St. Ben's taught you how to think and how to, more of the kind of the soft skills versus the technical skills.
Yeah.
And I can't agree with you more. I think that you have to be able to be relatable to people, to be approachable, to have good communication skills. That is key. You can teach somebody how to do a technical piece, but you can't teach somebody how to be compassionate and to be a forward thinker and motivating of others and
Holistic.
yeah.
Do you guys still do Dorothea Orem? Who's your theorist that you study? Who's your concept? Come on. Dorothea Orem, she's big body, mind, spirit. That's why I'm asking, because the
Yep.
whole, how you
Yeah,
approach
self-care.
your
Yep.
self-care.
That's
yeah.
what we had when I was here
And
too.
self-care
Dorothea
deficit.
Orem as a nursing theorist. No nursing
Okay, I
theorist.
just totally dated myself.
That's changed.
I have a freshman in college this year, so just pardon me.
But the whole point, you have people that are technically exceptional, and then there's some that are marginal. And then you have the performance of the team players and the people that are not. The ones that spend the most time in my office are the ones that aren't team players. Because the ones that are skilled, I can just send someone out to hopefully help train them. Whereas that team player, communication, not talking behind people's back, not sabotaging someone, those people will be out very quickly. And you just can't afford it, because we're in a field that our actions have direct impact on how someone feels. You screw that up, they physically feel pain or don't have the outcome that they desire, their family desires. Whereas I was talking earlier, if you're an accountant and you screw up some numbers, you have to repunch the numbers. You screw up, not turning somebody because you weren't willing to help me turn my patient, so now I struggle and I don't get the pillow under there, and now they're going to get a pressure point and they might get a bed sore, and now they have an infection, and it's just not worth it. So, I mean, you really got to believe it, and if you don't believe it, you got to make yourself believe it.
If you don't believe it, come to my unit, because the people who spend time in my office, it feels a little harsh, but I kind of put it this way. If you've ever read Quint Studer's Hardwiring Excellence, not that you guys have spare time to read, but it's about managing excellence, and it's about keeping the bar of performance at a certain level. And I always, people who spend time in my office, I invited an employee in not long ago, and I just said, I want to just have a few minutes of your time to let you know how I'm going to manage you out of here. And her eyes got about this big, but it's like, you know, you manage, I'm going to manage you up or I'm going to manage you out. We give our teams the tools and equipment to be really successful, but you all have to execute on that, and being part of a team is clearly part of that. Mm-hmm. And so really you opt yourself out of your own unit. We just help you unlock the door and open it as you're exiting, because teamwork is critical, a level of excellence is critical. St. Ben's teaches you how to do exactly what you need to do.
One of the questions I ask on my anybody I'm interviewing is, you know, think of a successful team that you've been on, whether it's a high school sports team or, you know, a church team or whatever it may have been, and what role did you play on that? And, you know, I was big into sports, so it's like, were you the coach? Were you the one that sat on the bench? Were you second string? Were you first string? Were you the cheerleader? Were you the ref? Like, what role do you play on a team? And then you build off of that. And it's interesting to see people, I just, you know, I don't know. I'm like, okay, see ya. You know, you've got to be you've got to be an initiator, I think, to be a successful nurse. So the team is critical. So, yeah, you have a question.
I have a few questions. For the hiring managers, as a new grad studying about the field a couple months, what is the best way to make yourself stand out on a resume? How soon should we be applying? And then after we do apply for a lot of jobs, is it important to take the first job you get, or just take something just to get your first experience, or should we really be waiting for something that we really like? Is it really important to really go and start off right away in a place that we desire to be in?
I don't know who's hiring, but I can tell you right now, I mean, the competition's hot, 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 hot. So, like I mentioned, because the facility I work at is Magnet, 4 years is kind of where I start. Probably much like your organization, there's a new grad. Many organizations have new grad channels, so new grad programs. So if you go onto their websites, you should be able to tell who's got new grad programs. For Alina, Alina has over 11 hospitals and 100 and some clinics. They channel all new grads online through the computer. And to answer about, gosh, what stands out, that's a question that's hard to answer for me, because people are so well-rounded, as I'm guessing each and every one of you are. I don't know what makes an application pop, because you can have 200 applications for one position. In my last hires, it's basically who somebody who knows somebody who is reliable. And again, I'd say if you're working in the hospital, regardless if it's or even in Alina as a, cook or environmental service, if you're in the organization already, you already have a foot up, regardless of what the position is. But it's hard to get a resume to pop. I don't know. Does anybody have a better answer?
I think when I look at a resume and I see poor grammar, I don't even, it's gone. I don't care
was number one on mine.
I don't care where you went to school.
And you'll be amazed at how many people.
It's awful. And when you submit, everything is online. So when you submit online, you have to make sure that, it's going to skew. What I print off in my office is probably not what it looks like on your pretty resume. It spits off just this boring old piece of paper. Right. And if there's a misspelling or just a poor layout of your resume, I'm not even going to look at it. So I think a well-written cover letter and resume are critical. But even just dressing appropriately for an interview, shocked at the people that show up in jeans for a nursing interview. I'm like, really? A thank you note after an interview goes a long, long way. Someone actually sat out in their car and typed it on her cell phone, because I had it before, like, she was even gone. Okay, that's a little aggressive, but maybe a handwritten note, just to be personable, but to go in and to be well prepared, groomed well, a sharp-looking resume, and that personal contact. In terms of timing, it takes about 3 months, I think, to onboard somebody. So by the time you interview a couple times, you go through getting your license checked, new employee orientation, it takes a good chunk of time. So if you can kind of back yourself up from what your goal date would be, start making that plan.
Yeah. Yep.
You can do that too.
You can upload it or fill out the formatted one.
Yeah.
Oh, I don't think so. No, I don't think so.
We don't use it currently where I'm at.
Yeah.
But I'll just echo.
What was that? A PDF. Yes. PDFs are great.
Yeah, I don't think Alina does that. Yeah.
And I'll just echo what she said. Treat the job like you care. Just even the application, treat the application like I care about this application. One thing that I'll look for is if somebody's applying, they'll say, I want a job. It's like, it's totally different than somebody saying, I would love to become a part of Park Nicollet and work in your tree orthopedic center and serve orthopedic patients in surgery. It means they actually did a little research and it's just,
Right.
and a lot of them have that block statement of why you want the job. So I mean, even just looking up something about the unit you're applying for,
Or
just knowing how many
the
beds they have.
organization, because like if you're a new grad, you all get kind of funneled into the same pool. So it's, you know, if you go on the website to Fairview or to Alina or to Maple Grove, you wanna know about the organization. You know, so if the organization says, you know, we're progressive, yada yada blah blah, I want to be part of that progressive team, et cetera, et cetera. Once you get an interview on a unit, work back with the recruiter. Talk to the recruiter and find out what kind of a unit this is. So I wouldn't wait right now. I wouldn't wait to just get your dream job. It may not happen for the first 5 years of your employment. So I would get my foot in the door and I would find out as much as you can about that unit. Is there anybody that works on the unit? Can I talk to somebody? Can I, you know, leave a message for the manager? I mean, I've had recently people come by and just physically hand me their resume, and I've got them stacking in a folder. The other thing that you should know is all the hospitals pretty much are union hospitals, so when I post a position on my unit, the union rules for nurses is that you have to leave it post for 7 days, and anybody internal to the hospital that might want that position has seniority to get that. So oftentimes I'll post a day-evening position and it'll sit there for 7 days and then it'll pop with somebody internal has the seniority, and then you have to say, okay, now what position do they have? You have to repost that position. Then if there's anybody else internal that wants that, so that whole chain of repost can go on for a couple of ridiculous months. So that can play a factor. I just hired a new grad last Friday, and I've been working with her for a couple months, but it's all because of the whole repost. So there's internal union process that we also have to follow.
Utilize your career resources department here. They are wonderful. And when I was applying for grad school for the past couple months, it's a huge process, and I contacted Mary and I was like, help me. So she did, and they're wonderful, and they'll keep on helping you. So they know tips that you kind of even wouldn't think of. I have a phone interview on Friday, and I was like, oh yeah, I'm going to wear my sweatpants. And she's like, no, just professionally. So just those little tips that you might not even think of that really are important to make you stand out and just present your best self. And so it's helpful.
Be on time. Don't show up late.
Or chewing gum.
Yep.
Or texting.
I mean, it's pretty straightforward stuff, but I mean, we're human. I mean,
Right.
there's no, this is everything that you have to fit to get this job. We're human. And there's stuff that we might not think that's affecting our decision that does. And every one of us is different. But those are things, I mean, you just hear the chewing gum, you think, oh, who cares? That might annoy one of us. Showing up 5 minutes late, we might be like, are you kidding me? Checking your cell phone and texting during an interview.
Because we're
Are you
usually
kidding?
meeting hopping, so we are like, we gotta come, we gotta go, we gotta come, we gotta go, we got, you know, so.
But it's just those, paying attention to those details. On your resume, don't let stuff default. Like, it'll be like Savage, Alaska.
And then when
The city
you,
was Savage, but the state defaulted to Alaska because it was first or whatever. It's like,
right.
they just didn't want to put Minnesota, you know?
And
pay
then when you
attention to
get a
the
job,
process.
be really good at it. Be really
easy,
good
though.
at it. That's, well, I don't know. Some people think it's a given, and it's
There's
not.
lots of people that need a job and will take your job if you don't want to put the effort into it.
Yes, right.
All right, we're at 8 o'clock.
Good question, yeah.
What else do we have?
I just
Just so we don't run too far over.
anything to
Yeah.
say. Be very patient with the job application process and be very persistent. You might not get the first job you apply to, you might not get the first 10th job you apply to, might not be the first 50th, but there's one day, there's that time, you're gonna find a job that you like, you love. I felt defeated because I couldn't find a job before I graduated. My friends all found jobs, who did internships, who didn't do internships, who had a nice capstone site that decides to take them in. I had no job at the time I graduated. At one point I was like, what's wrong with me? I don't know what's selling me short, but there's nothing wrong with me. I find a job that's really nice that I really love in June. It just takes me one more month from graduation. And I have friends taking positions at home health, public health, which is nice positions, but it wasn't their dream job. And now they all moved into hospitals. It just maybe takes that extra month and takes a little bit patience that everybody can do.
A quick story. One of my hires I've hired in the last 6 months, I actually was in the nail salon this summer, and I was sitting underneath the dryer, and there was a mom and a daughter talking about, oh, my daughter this, my daughter that, she's just going to be the best nurse, and it's really too bad, you know, she's really regretting not coming home from Wisconsin, and all her friends have jobs, and she could have, and now she came home, and man, she's missing out, and everybody's going to be amazing. And they were like talking about her in such a way, and I was watching over time and listening, and I was managing in an interventional, and you have to have 2 years of critical care experience, so I knew I couldn't hire her, but I was so intrigued by the family dynamic that I'm like, say. So I started this conversation with this family. We went back and forth. It took me a while to be able to hire her, but she's working on the unit. She's just finishing orientation. She's phenomenal. So there are kind of some of those funny
I want to tell you, too, real quickly. 2 of my 3 children are registered nurses. None of my children were going to work in healthcare. They were going to do something totally different. And it didn't work out that way. My son went to school here in St. Cloud at St. Cloud Technical College to be an electrician. He graduated the year 9/1 took place. He spent the next 5 years getting consistently laid off from one job after another. He came home to where we live by Duluth, and when he got laid off again, and said, Mom, I am so sick of this. I'm going to go back to school and be an RN because you never get laid off. And I said, Ryan, that's a real interesting rationale for choosing a job. Remember, you're the kid that faints when their blood is drawn in the lab. He said, it's different when it's your blood and your arm. He said, I'll be fine. He went to a 2-year program at Fond du Lac Tribal and Community College in Cloquet. It required that you be a CNA. It required that you be an LPN before you go to the RN program. He did all of those things. He finished school. He finished the same year my middle child went to North Hennepin Technical College in the cities, finished a 2-year degree. She worked for 5 years at Abbott on the OB unit, all 6 units as a transcriptionist health unit coordinator. When they graduated, they both were told that no one would hire them because they didn't have any RN experience. So they both moved with my son and my daughter and her husband, and my son all moved to Richmond, Virginia. Ryan got a job at Virginia Commonwealth University working on a forensic med-surg intensive care unit downtown Richmond. And my daughter got a job at a hospital in Petersburg, Virginia, just south of Richmond, working in a med-surg oncology unit. Got fabulous experience, worked there a year, weren't real crazy about the East Coast culture, weren't real crazy about people calling them Yankees, but they got their experience. They came back to Minnesota. My son works on the 6th floor at St. Cloud Hospital on the neuroscience unit with strokes and traumatic brain injuries and neurosurgeries, and my daughter works in orthopedics at Fairview Southdale, and she's in the doctoral program, the Doctor of Nursing Practice program at St. Scholastica, and my son just applied for the same program. So, you know, you got to find different ways of getting where you want to be. You just have to be persistent and not give up.
I'd like to say, too, once you get that job, be involved. Even if it's not your first choice job, there are so many committees And I'm on my unit part of the Nurse Practice Council. So there are just a few of us that work with the pharmacists and the physicians to make nursing protocols. So you can make a huge difference, make your voice known. I'm also in the Association of Pediatric Hematology Oncology Nursing, and we just do volunteer projects. It's really fun. So even if you're like just a staff nurse, you can be so involved, and that will lead you to your dream job eventually too. So it's not just a staff nurse. You can be really involved, and it's a lot of fun. So another tip.
And you can meet neat people that can open doors of opportunity
Absolutely. Yep.
I think the job tips that we've given you don't just have to be for an RN for your first job. It's if you're going to get a summer job anywhere, doing anything,
Yep.
always be prepared.
Be prepared and do it well. Work hard.
Mm-hmm. Take care of yourself so you can do it well too. That's a big part.
Thank you.
Anything we missed?
Be glad to stay around and talk.